Hey, I'm Scott with ECRM, and here at our one of our pharmacy sessions, it's focusing on technology, supplies, services, automation, and we had our thought interaction pods. I'm here with Lyndsey McDonald, who moderated one of those discussions, and your topic was evolving the pharmacy staff, as we prepare for the pharmacies of the future. And just wanted to get your thoughts on what you see the pharmacy of the future, and what is the message to pharmacies, and how can they better position themselves to be in the right spaces as we move forward.
We talked a lot yesterday about what the tipping point might be. We know that pharmacies are playing an incredibly important role in healthcare delivery, and there's a great opportunity for pharmacies to provide more services to their community. Patients go to their pharmacy way more often than they go to their physician, and we think there's great opportunity for pharmacists to be able to provide things like point of care testing, health coaching, and disease management services. All of these are great for the patients, but also great revenue generators for the pharmacy. Of course, there's problems if the pharmacist cannot bill for those services. So once that happens, we think there will be really just an onslaught of additional opportunity to come for the rest of the staff.
And that's the future. That's where it's coming, is being able to bill for more and more of these services with that patient engagement.
We hope so.
Yeah. Fantastic. What are some of the challenges today, regarding preparing? Is there a hesitation from the pharmacies? They seem like they're expected to do more with less. How do they handle that?
I think that's a great point. Pharmacies are expected to do more with less, but I think there's also great opportunity to empower the technicians to step in and help with some of that extra responsibility. We find that a lot of pharmacists feel very protective of some of those dispensing duties, but if they focus more so on working at the top of their license and providing those clinical services and other resources to their community, like I just mentioned, and instead rely on their techs to do some of those duties that don't require any clinical judgment, but do take up a lot of the pharmacist's time.
Sure.
That's a great opportunity to work together as a team and provide your community with the best care possible.
Yeah, fantastic. And then from health career associations, what type of services do you provide that can help to facilitate that?
So we provide national certification for pharmacy technicians and other allied health professionals. So we work with ambulatory care facilities to certify medical assistants and phlebotomy technicians. We see a lot of correlation between those two professions, the technician and the MA, when it comes to administering immunizations, for instance. MAs are doing that in physicians' offices. Why not allow technicians to do that? So we're working with pharmacies to train and certify their technicians and really use them to their fullest potential. So techs see their role as a long-term career, not just a job to pass the time. Yeah,
fantastic. Was there anything that came out of your pod discussion that surprised you, or that provided insight that's somebody else is doing already that others may not have been thinking about?
There was some comments from a health system in Brooklyn that talked about the one-on-one training that they are providing their technicians. They are involving them in patient interviews to do med rec, and they have been able to see their outcomes just go through the roof. Reduced readmission, meet all of these fantastic goals, and so they are really looking at some interesting ways to include technicians in the care team in order to see positive outcomes. So that was really, really exciting.
Well, really appreciate you taking part in our Thought Interaction Pods. Appreciate you being here, and thanks.
Sure. Thank you.